So this is your stockinette, right? When you have your stockinette and this little ripple is right here, so you can just simply just cut a little piece off. So I kind of grab it and just cut a little piece off of it. Perfect. So now it kind of lays it nice and straight for you, and it doesn't rip, doesn't wrinkle for you, right?
Right.
Next thing you're gonna do is your cast padding. This is flexible, right? Because it stretches out.
Yes.
So go against the foot. You want to watch me and then assist me as we go?
Actually, I want to attempt it.
All right. So here you go. That's what I like.
Right.
Get it, Vic. Okay. So you're gonna go down. You're gonna do your figure 8 with your cast padding. Go around that ankle. And have your patient move over this way so you have the space. So go around your ankle. There you go.
I don't want her to be free floating.
Free floating is what you want. Free floating is what you want. That's what you want, really. Beautiful. And you go all the way up. 50% coverage, just like your coat-band. I mean, just like your Unaboo. And I'm going to move your leg over this way. Then it allows them to even bend that knee. That's what you really want right there, right? Oh. You want to be able to see the bend without it going too high up. So bring this bad boy down right here. This should be your cutoff. 3 fingers, 4 fingers, enough to where they can bend and flex and not be feeling that cast. So this here, a little trick I do is just tuck her in so it holds up. Then you get your next cast padding, and where you finish, you start off again. Down, 50% coverage all the way down. The doctor wants you to get some heel support, right? For heel transfers, if that's what he wants, right? You can do something like this, and you can give it additional padding for heel transfers. You'll see some people rip this off or don't rip it off, right? Yeah. So I'm gonna show you how I'll place it without having to rip it off. So you fold it, you either bring it around the heel like that, and then you can wrap it around, and you go around and you give it that figure 8 again. Do my fold. I'll fold from the top, bring it down, give it a nice cushion, right? A nice little cushion for you. So where it's not tight, you can fit your fingers. So bring her all the way up, nice tightness, give it a nice pull, a nice little cushion. Beautiful. Now you can get your tongue depressors. These are your tongue depressors, and you can slide. So you be very careful with your patient because you never know if they have a wound, you always what you're working with, or they're fractured. You kind of give it some space so it allows that when that cast tries to dry up, that it doesn't completely compress it. So now is when I put off, right? I usually like to look under to see where I'm going with this. So you want it to be supporting right there without folding your sock. You see this?
Yes.
Right there. Boom. And up. There you go. Do it twice and then work your figure 8. Beautiful. There you go. So these you don't pull, you kind of just let her lay down. There you go, around that ankle. Beautiful. This color is so pretty. Give me that. Beautiful. And you kind of just let it roll on the skin because you don't want it to be tight.
Because if it's tight,
I'll be your assistant. If there's free people in the clinic, you can always get someone to assist you, but most of the time it's you by yourself, right? So let this do what it needs to do. There you go. And work your way up. There you go. 50% coverage. Beautiful. So if I'm working by myself, I'll get a bucket of water, put it on the ground for me, so it's something that I can open up my casting and have a dip, and I have to keep getting up and down, right? You also want to focus on your angle. You need a 90-degree angle. So your patient's doing wonderful right now. Toes to nose is a great way to do a 90-degree angle. Or you can use a contraption that we have that actually places it in a 90-degree angle, right? And you can just finish that off, and where you finish, you start up again. Ask your doctor if you're going to place them in a 90-degree angle based on their fracture. If it's an Achilles rupture, Achilles is healing, then there might be a little plantar flex until it heals it. So grab it like that, and then grab it when you go to grab it with the other hand with the same hook. And grab. Hook them together. There you go. Hook them together. There you go. Soap in your hands, but I'll show you. I'll take some soap and water, and it helps for the ridges, so you can always smooth them out. And put soap and water by smoothing out. And this part, you're gonna open it up at the end, and then I'd be like, here, if I'm your partner and I'm helping you place this, give me your hands. I'll get the soap on your hands, so then you can smooth out your ridges.